Well, good morning. And this morning, I want to welcome a special guest and a really important friend. And Robin has been a friend for many years now. So Robin is from Indiana. I don't know if that's originally where you're from, Robin, or just where you live.
Been here since my 20s, so. Yeah.
Okay, pretty much feels like pretty much your home. So Robin is someone I want us to talk really strongly about what's going on. Robin is someone who works in residential care. Robin, tell us a little bit more about what you do for a living.
Well, normally memory care coordinator, but my roles have changed in 2020 more rapidly than I would like. This is a fine example of how it's changed. Greeting my elders every day like this.
Wow. So rather than be a memory care coordinator and someone who has a lot of PAC training and a lot of PAC skill and a lot of PAC commitment and confidence and competent and actually brought a team into this and really has been working on the culture change in community, then to suddenly be zapped with COVID-19 and have it be basically hijacking everything. So from the very beginning, tell me about your community, just as far as did you opt to socially isolate individually or as a small family community? What did you opt to do from the leadership?
So we really were mandated. Can you hear me with this?
Yes,
that's always the question.
I'll duplicate what you say frequently so that everybody can enunciate a little bit because, yeah, we've got the mask, we've got the shield. I mean, it's really an echo chamber and it makes it hard.
Yes.
So
the CDC decided that what we would do. So,
oh, I'm so sorry I'm doing this in front of you, Robin. I know you're not allowed to do any of this while you're doing that. So, yeah. Okay. All right. I'll do an empathy thing.
And then of course the governor comes in and so we just have had a lot of regulations on what we can't do.
Not a lot of, did you give them guidance on how to engage people and keep people at care plan support?
Absolutely not.
Yeah. Yeah, that's what my experience was too. I mean, there's no guidance on, so how do we keep people living with dementia particularly actively involved in their lives while we're trying to reduce the risk of COVID, knowing full well that we probably are not going to be successful at completely stopping it because we haven't even in hospitals been successful at that. Yeah. So individually isolated, hey, then.
Yeah, so we isolate, we are directed to isolate. So there is no communal dining.
Even 6 feet apart with separate tables where people could just see one another and be in the presence of one another and maybe then have music after. Oh, music. Well, yeah, I mean, spreading those germs, eh?
Well, how do you do that in a small space?
Well, how do you value being together versus risk of COVID if nobody's going anywhere? I mean, families are sheltering in community because they know that whoever goes out to the grocery store is taking a risk. But the people who are going to be together, they opted to create a family unit. So here's a question for you, Robin. I'm curious, did anybody ever ask the individuals who are there and or their healthcare representatives, so I'm going to give you a couple of scenarios. What is your preference? Was there what would be your call if it was this or this? What would be your call? Do community dining, knowing it's 6 feet by 6 feet, knowing that it does increase the risk slightly, but at the same time, it does provide socialization for people who basically were part of the reason they are here is for social maintenance because that's a problem. Or socially isolate, knowing full well that they will probably have to receive fewer minutes of care just because going in and out of the space and bringing things and taking things out, we have to do a lot of procedures around that. So was there a question for that? I'm just curious.
Let's just say what I'm seeing is and I'm saying many, many
Oh.
couples that have been married over 50 years, and I'm losing count of the days, 250, 256, have not seen or touched each other.
So what are we keeping them alive for? One of the very most important people in their life, they're not being able to be with and be around and have connection to in any way, shape, really, or form often because of the level of or the degree of cognitive impairment. Physical presence is such a critical piece of it. So let's take a look at you, speaking of physical presence. So this is what they get to see, hey?
Yes, this is how I get to greet them. What am I?
And care for them?
Scary.
Yeah, I mean,
and take somebody that's living with brain changes, and put them into the shower
with these people around.
Remove their clothes when you look like this.
So I'm going to best guess that the use of medications to try to manage behavior has come back online, even though we had worked so hard to move the culture forward out of that behavior, knee-jerk, let's use a medication, versus let's use good connection, permission, and care routines.
Well, I do have a little control over those medications in my building.
Okay.
So I will tell you that I absolutely say no antipsychotics. No.
Okay.
So
you're still doing that. You're still
those that, and I guess for the best term is if they are, and I don't like the BIMs, I don't like the mini mental.
Right.
But if their BIMs is 12 or above, and they're telling me they are severely depressed,
yeah,
we may see trying an antidepressant, although do we see results is the question.
I mean, unless we change some other things, in my experience, antidepressants for people living with dementia are only, you have to adjust the med, but then you have to verbally and physically engage. And then you've got to up the activity level, and you've got to put it all together, or you're not going to see a change, because this isn't just change the chemistry and see everything click back online. That's not what happens. Right. And if this is what I'm looking at when we do everything, I'm not sure that's going to inspire me to be less distressed, depressed, anxious. So let's talk about you. Not you just individually, but let's talk about how you care for yourself when you're in this outfit. And you're going from place to place, person to person. You're obviously going to have to take your gloves off, clean your hands, put new gloves on. What about the rest of your outfit, though? What's the current recommendation as far as the rest of your outfit when you go from space to space, person to person?
So I will walk into the facility. I'm immediately screened, all the questions, yep. Temperature, etc. Gown, N95, gloves, mask, or face shield. Then walking into a room, I then put another mask over this one, and of course clean gloves each time, then another gown over this gown. And because of the shortage of PPE, then I'm in an elder room 1, I remove that gown, put my name on it, hang it on a hook, remove my gloves, and all the biohazard is in that room. So I'm piling up this stuff in their room, remove my second mask into the trash, and then I go to the next room. Then I clean all my equipment, my pulse ox, my thermometer, my blood pressure cuff, etc. And then I move to number 2. So taking care of 8 to 12 patients is time consuming just for the dressing and the cleaning.
And how sweaty are you? I mean, I'm not being ugly, but oh my gosh, that's a lot of layers. I mean, so you're losing hydration through sweat, and it's just a temperature thing. And how have you had anybody really become overwhelmed with heat? Because I know this is reminding me when you're talking about this was my experience on the burn unit. the acute burn unit of a tertiary medical center that cared for really severe burns, where we would go in and we would have to do the double layering, and we were debriding wounds, and then and you were like, and I can remember feeling physically sick because you can't cool the room, because the patient in those cases needed the warmth. I mean, as our elders often, they have to have the warm environment or this becomes unbearable.
Yes, that's true. And on our gated communities, those rooms are very warm. Those 90, 100-pound women are always cold, wearing sweaters in the summertime. And the heat in the room is 76 to 80 degrees. So yeah, you get hot and you don't smell very good at the end of the day.
No, I bet you do not. There is no way you smell good at the end of the day. You don't even feel good at the end of the day.
No.
So now the other reality is, with all this gear on, how do you hydrate yourself? How do you eat? How do you take care of your own facial needs, your own body needs? How do you do that?
I'm going to say I'm not doing a very good job. I can very quickly, 6 or 7 hours into the shift, drink a quick bottle of water, probably in one sip. But I still am not getting enough hydration because I don't need to eliminate anything. I do a protein bar on the way to work, but I do not eat when I'm on this unit at all.
Yeah.
And I immediately walk in the back door after work, strip at the back door, kick the clothes down the basement, and head immediately to the shower.
Yeah. So what's happening is you're spending over 10 hours straight, not really eating, not really drinking, overheated, having to be on alert for everything, trying to keep track of all these different people's needs and what they did or didn't do that cycle, and where you left things when you were in and out. What about residents who like to move around in their room and get into things?
That all depends on the staff member. You try to direct as much as you can, but a lot of times we just cause more problems by doing that.
Yeah, I mean, so that waste that you're talking about, now you have another layer of having to do things. I mean, now you're having to take everything out, which means now you've added another element to it, or you don't know what they're going to do with it while you're gone and coming back. And now you've got to, so how about your own discomfort? Because it can't be comfortable. I mean, we've already established that. How about your own discomfort? Is it just uncomfortable? Does it move pain after a while?
The N95s actually are very tight fitting around your face. And the first day that I wore one and removed it that evening, I brought back a memory of when I got hit with a baseball bat in the 3rd grade.
Wow. And then to think I'm going back again tomorrow and doing it again for how many hours? Yeah. I mean, wow. So I'm curious, if you were to track your affect and mood over the course of this 8 months now, I mean, it was initially, I think everybody thought a couple months will be good. We can get back on track. We'll get this figured out. And it feels like we're still at a place where we're in emergency mode, and we have not at all considered longer plans, because this is like we're on hold pattern on the tarmac. And remember, they actually determined 3 hours, you got to take them back to the gate, man. This is not okay. You can't just keep people on the tarmac forever waiting for takeoff, because it's just not, it's not humane. It doesn't seem like we've gotten that place with people living with dementia in care or staff.
I understand keeping them safe. They're a high-risk population.
Yeah. What does safe mean, though?
Exactly. Because am I allowed to go to the grocery store? Yes. Am I allowed to go get dog food at Rural King? Yes.
Yep.
But my elders are.
Am I allowed to walk down the hall like I used to?
Right.
Am I allowed to go get a cup of coffee where I used to go down and talk to the staff when I got my cup of coffee and hang out for a little bit? Am I allowed to wheel my wheelchair down the hall? Am I allowed to go visit that lady that's across the hall that sings? Am I allowed to sing? Am I allowed to, what am I allowed to do?
Yeah.
So would we describe it at this point? And I'm not trying to be ugly. I'm really trying to figure this out. Is it more like a prison system, or is it more like a care community?
I think the one statement from an elder that affected me the most was, because remember now, I'm getting swabbed twice a week. I've lost count of how many times I'm being swabbed without symptoms.
Yeah.
And our elders are swabbed every week.
Oh my gosh. Oh my heavens. Every week?
Yes, ma'am.
Immediate turnaround, or you still don't know for a day or so?
We know within 24 to 48 hours.
Oh dear. Oh my, we're still there. So we don't have immediate readings.
We do. We do if they have symptoms. I
know, but so
I know.
Wait, so we can do it if they have symptoms, but if they don't have symptoms, which would be, to me, if they have no symptoms and they're negative, why are we still using these level of restrictions on them? Especially, that would be the time to use the immediate, because if they started and we could go, oh, geez, man, we need to really, and are you using still deep nasal, or are you using something more modified? Oh my.
Yes. So just remember that it's not us that's making those.
I know that. Yeah, I know that. That's the requirement.
The one comment that a gentleman with brain changes said when I swabbed him was, "Why did I get sent to the concentration camp?"
Wow.
And I think that's what he's seeing.
That's what it feels like. Yeah. Yeah. It feels like, I've locked in. I have no choice. No one is listening. I'm here and no one's ever going to rescue me. And there's no allied forces coming.
Right.
Unless we start going, wait, leadership, wait, state, wait, national people. You are not really listening to the people you're serving. This is not ground roots family. These are ground roots people who are living the condition, and everyone else in this nation has some options. And yet when you develop dementia, apparently you lose all choice, and we will do what we think is best for you, regardless of whether you tell us it doesn't feel best for you. As a matter of fact, it feels pretty dramatically awful. And actually I was a risk taker before I ever got dementia. I want to reduce risk, but not to a place where I'm miserable. I'll reduce my sugar intake, but I'm not going to actually not eat anything I enjoy, because why would I, so if I was that way before dementia, why would we assume that suddenly I wouldn't still be me, even though my brain is changing? Wow. Well, to tell you thank you is not enough. And to grieve with you is the minimum I can offer. And to celebrate moments that you are successful, and to recognize the heroism of both the people who are being asked to do this work, but also the people who are living in these situations, and to be frustrated with the lack of awareness that is our national and regional leadership in the world of dementia care, to think that this is care versus, I think the elder said it well, it's like living in a concentration camp when, as far as I know, I didn't do anything that should cause me to be here, except apparently get something that I can't prevent, can't cure, and can't even stop. And I've lost connection with everyone that used to make a difference, and even recently made a difference, because they're behind all these layers that I can't even figure out. Well, Robin.
More important is remembering positive approach to care. I still have this, but you must go in, go slow, approach them on their dominant side, hand under hand, and make them.
See, and I was so lost in the distress that I forgot the thing that we talk about all the time, which is we can make a difference even there. So we're in the camp together. We don't wish it for each other, but when we use what we know how to use, we can still reduce the risk of bad things happening. And we can improve the quality of what we can offer. And so that, I suspect, is part of what keeps you being able to do this horrendously hard work and painful work frequently. So thank you. Thanks for reminding me about what it is we can do that makes a difference. Thanks, Robin.
You're welcome.
Hey folks, thanks for watching. Please like and subscribe to help us spread Teepa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.